viruses don't stick within national borders. They are very, very difficult to contain, especially ones like this. As I understand it, from my contacts with people around the world, the one thing the general public wants is united efforts by everyone, bringing together the best scientists, the best leaders to work on this issue together. And as I've said, the majority of nations are really supporting global efforts. And they're saying, we will back our World Health Organization in order to get on top of this, because we know that united action is key. And I do really hope that the American people can persuade the president to rethink his decision, because in my experience, Americans have been some of the best supporters of global action for health, particularly in the face of outbreaks like Ebola, polio, HIV, smallpox. The United States has been there and has been part of the response. And I really wish that we could continue to have the United States working on this issue.
I think that's the fear, is that cooperation between nations is not where people would like to see it. I mean, that's in some part evidenced by the steps the U.S. wants to take. And just on the U.S. announcement with the WHO, I mean, they have highlighted some concerns as to what led them to that place. Some of them being that President Trump feels that early warnings to the WHO weren't raised to the level he would have liked to seen. I mean, we heard from a member from the Taiwan CDC talking about the fact that they did raise red flags about human-to-human transmission, and they felt the WHO didn't take them up. Looking back, do you think there's anything the WHO could have done differently, whether it was perhaps backing down on some of their praise for China or perhaps declaring this a pandemic sooner? I mean, what would have been a way to improve the response?
Thank you very much indeed. There's a very clear timeline of what the WHO did. And that's also available for complete and forensic examination by anyone who wants to. There are very clear rules about how the WHO works that are set by its members. For example, your mention of Taiwan is important. The WHO Secretariat does not make decisions about who's a member of the organization. That's made by the countries. And so that it's really, I think, wrong to blame the Secretariat for what are perceived to be missteps in regard to the relationship with Taiwan. Lastly, whenever there's an outbreak, there's always a detailed examination. There are always things that could have been done differently, of course. And we expect these kinds of after-action reviews. We're waiting for them, but we really do ask all of those who are concerned about world health not to do a forensic examination right now, not to withdraw support right now, just as so many people, so many countries are having to battle against this new virus and to cope with the terrible impact of containment measures. It's a global crisis. It's a terrible crisis. And we're, as I said, needing to deal with it together and not with people pulling apart, and then do the analysis when we've got the situation under control. We're all expecting that, and we would really welcome it.